Thank you for joining us. This is Marla Dalton, Executive Director and CEO of the National Foundation for Infectious Diseases, or NFID. With me today is Dr. Bill Schaffner, Medical Director of NFID, who has graciously agreed to answer some questions around COVID-19 and the current outbreak. So Bill, regarding this outbreak, what should individuals in the U.S. be doing right now?
Well, Marla, I think this is a good opportunity for prudent planning and preparing just in case, both on the personal side and on the professional and business side. Let's think about what we might do personally. It would be good to have a little after-dinner conversation at the family dining table and think about things such as this. What would we do if school's closed? Who would take care of the children? Should we be going to the bridge club to play bridge and sit opposite people who might have the infection? Is this a good time to watch TV instead of going to the movies and to the mall? If you attend religious services, maybe rather than joining the congregation, this might be a good time to be reverent at home. Oh, Grandpa Tom's medicine supply. We better make sure he has enough for 2 or 3 weeks. Those are the sorts of questions that a family in a discussion can come up with, and they can think about now while it's calm, rather than panicking or getting very anxious if all of a sudden circumstances require that some of these changes are undertaken. These changes of social distancing so that we become kind of semi-hermit. On the professional or business side, it's also important. Are all these meetings essential, face-to-face, or could we do them by phone? And by meetings, I mean both local meetings and meetings that require travel. How many folks in our circumstance could work from home? That won't apply to everyone, but some certainly could. And then, if you're planning large events that will draw sizable numbers of people, I wonder if, do we need a plan B? I wonder if we really should hold these events. Think about all those. Those are not easy decisions. They're difficult, they're discomforting, they may even be costly, but they may be necessary. And now's a good time to think in advance what the circumstances might be, and then what your local response would be.
That's really helpful, Bill. I guess the real question is, are there any specific things that people should not be doing now?
Yes. Well, they should not be doing nothing. They shouldn't be sitting back kind of just waiting for events to unfold and then respond. Now's the time to think in advance. They also shouldn't panic. This is the time that we have the opportunity to be thoughtful and considerate about things, and even have another meeting and a third meeting, because as you go along, new things will occur to you, will be brought up that you can find are worthwhile to discuss. Also, something that should be done by all of us, we should be attuned to local and state public health directives. Be sure that you are aware, and they will communicate via the television, via newspapers and such, via their website. So they will keep you appraised of what the local coronavirus situation is and what their recommendations are. So stay aware of what's going on locally.
Great. Let's switch the conversation to healthcare professionals. Are there specific things that they should be doing now, both in terms of their own safety as well as dealing with patients and testing?
Well, it goes without saying that healthcare professionals should acquaint themselves with what's going on with the coronavirus, both locally and nationally, and I would even add internationally, because they're the folks who are going to be asked questions and get the answers to all of those frequently asked questions. We have some on the NFID website, as does the CDC. So become acquainted with those. testing is an important issue. Who will be tested? Where will testing facilities be located? Your state health department, will there be private laboratories that will offer testing? So healthcare providers need to be acquainted with all of that and the guidelines about which patients should be eligible for testing. And then also consider infection control precautions in your own location. Clinic, emergency department, hospital, wherever you function as a healthcare professional. Think in advance. In fact, think right now. What do you do when a patient comes into your facility who's coughing and sneezing? Do you have infection control precautions in place and procedures so that you can manage that patient with maximum safety for the healthcare professionals involved? If you're in a hospital, I'm sure you have a pandemic preparedness plan that you've worked on in the past. Well, it's time now to pull that off the shelf, dust it off, review it, update it, and reacquaint people with all of those details. You might want to have some meetings about that because, after all, there may be some changes in your facility, new construction, for example, or renovations that change some of the details of the plan, and undoubtedly, some of the folks who were around the last time you went through a drill with that plan, they're now gone, and there are replacements, and they may not be familiar with the plan. So now's the time to dust those off and run through them quickly so that you're all on the same page.
Great. So besides not panicking, are there any other specifics that you would advise healthcare professionals not to do?
I think they obviously should acquaint themselves with good information about coronavirus. They are going to be the sources of information, not only for their family and friends, but for their patients, and they may be contacted by the news media. So it's very important that they have in their own minds some clarity about the coronavirus situation.
Great. I really appreciate your time. Just as a parting words, I guess, do you have any final words of advice, or what is the kind of single most important thing that our listeners need to know?
We always say, Marla, that communication is so very important. And I think in public health, we would put transparent, clear, solid communication at the top of the list. And that means that the rest of us need to put listening at the top of our list. As that information comes out, please pay attention, be thoughtful about it, don't panic, remain aware of what's happening locally in your community and your state, and of course in the country. It would even be advisable to know what's happening internationally. That information is available. Pay attention, and you'll be better prepared to deal with your local circumstance when the time comes.
Great. I guess it goes without saying, wash your hands frequently and properly.
And yes, of course. Of course. I mean, we have all of those personal suggestions and admonitions. Wash your hands very, very thoroughly and frequently. That's important. Avoid people who are coughing and sneezing. If you happen to cough or sneeze, don't broadcast it across the room. Do it in a tissue or into the crook of your elbow. If you do become sick, don't just show up in your healthcare provider's office. Call in advance, because if you walk into that waiting room, you may be sharing your virus, whichever it is, influenza, coronavirus, respiratory syncytial virus, with the other folks who are there waiting. And we don't want waiting rooms to be a source of viral distribution. So pay attention to all those things. And remember, wearing masks, surgical masks, out in the community probably provides very, very little protection, if any at all. Save those masks for the healthcare environment so that healthcare providers don't run short.
Thanks so much, and thank you again for listening to the Schaffner Report, the Coronavirus Special Edition. Have a nice day.